I came to Sierra Tucson late in 2010. I was asked to come on board as the chief of pain medicine and was fascinated by the challenge. When I came there, my goal was to really take the pain program to the next level. Early on, I heard Mark Pirtle's name. He had actually developed the pain program back in 2007, long before I had been there, and he wasn't there at the time I started. And I came to understand that Mark had a mindfulness-based strategy for dealing with pain. For me, the pain program absolutely needed a mindfulness component to get the best result. So we ended up making connections, and Mark and I had a conversation about pain management and how we thought it best be done and to get best results. We clicked a lot, and over the next couple of months, we made some arrangements to have Mark come back in and be part of the program. It's been really exciting experience. It's been very helpful to the pain program, and definitely a great move all the way around. You know, every patient is different, and every patient will find something, some gem to take home. And I have to say, since working with Mark and having him part of the team, that it's not infrequent that they get a very important little gem to take home from Mark, something that they'll bring up all the time. Oh, Mark asked me to take a look at my pain from this perspective, or he showed me how my mind was really getting in the way of getting better. And they carry that around as part of their thinking and reprogramming. And so definitely for a lot of the patients, Mark is an important piece of getting better, breaking through that mind-body barrier that's been holding him in the pain. One of the intriguing challenges of the pain program at Sierra Tucson is that many of the patients don't just come in with a pain problem. They have several things going on, what we call co-occurring disorders or dual diagnoses, depending on your language. So the most common things that are connected to the pain program are people that have problems with addictions or problems with mood, especially anxiety. These are things we see all the time with the pain patients. And to get a successful result, we've got to treat the whole person. We've got to treat all of that. And here is where a mindfulness approach and Mark's skillfully aware approach really pays off, because we cannot rely solely or primarily on medications to treat these problems. It really is anxiety-based, mind-body-based kind of challenge that patients need to work through. They need to gain tools on the inside and not rely on an external medication or treatment to be able to sense that they're back in control of their bodies. Mindfulness type strategies, it's a huge part. I mean, it's well researched. We know that it makes a difference. We know that when people can practice these skills, pain levels drop, anxiety drops, mood elevates, and so it's a key piece. Mark is a key player in making that happen, and we've seen some really nice results.